Hello, everybody. It's not a secret. No, not at all. Every one of us wants to have a profitable and successful veterinary practice. And I will say, rightfully so. But there is a big question. The question is, how? Well, the answer is very simple. Yes, answer is very simple. And that is good medicine leading to good money. Good medicine leading to good money. Yes, sir. Believe me, they are synonymous. I'm going to assign you a homework. So, here is your homework assignment. And if you follow my instructions, I guarantee you, you will have a big smile on your face while going to the bank and a healthy patient plus a satisfied pet owner who will not complain about paying your bill. That will be the wonderful balance. So, here are my three suggestions. Suggestion number one, each day perform at least one of each five tests. Let me reiterate again. Each day perform at least one of each five tests. What are those tests? I'm going to let you know in a minute. Number two, be careful and pay attention to the key, because the key is what you say, not how you say it. So be careful and listen to it very carefully, because the key is what you say. And number three, follow the rules to the T. Now, let me tell you the five vital tests. These are the five vital tests. And number one is, when you talk to pet owner, you emphasize that you are going to do a test which will protect his or her children's and the family members from worms. Yes, let me emphasize it. You are not going to tell the pet owner that you're going to do a fecal test on Barney's stool sample. No, 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 no. You are going to say that you are going to protect his or her family from zoonosis. And to prove your point, you are going to give them a flyer. What every pet owner should know about roundworm and hookworms, published by CDC. Your pet owner might ask you what in the world zoonosis is all about, so you might end up explaining to you. But always back up with this flyer produced by CDC. You must also emphasize that this pamphlet is published by the Center of Disease Control for humans, not for pets. Number two, whenever you confront or come in contact with senior citizen, always say, it ain't easy to be a senior citizen. You are going to specifically mention to all your senior citizen pet owners. Believe me, you don't have to tell a senior citizen what that means. And it ain't easy. They know it. They understand it. They also know their numbers. This is a key point. Ask them, Mr. Smith, you know your numbers, don't you? What do you mean by numbers? They know their numbers of cholesterol, sugar, diabetes, everything, and so on. Ask them that their senior pet also deserves to have their numbers checked, don't they? If you know your numbers, don't you think your senior pet also deserves to have their numbers checked? Chubby pets. Have you seen pets like this? Of course. You have to emphasize that all chubby pets, before consultation and putting them on a special diet, their thyroid glands must be checked. And believe me, if your pet owner is slightly overweight, they know, because their physicians, they always check thyroid function test first before they even go further. Number 4, ear bacteria and fungus. It really bugs me when I see general practitioner, the moment they see there is something wrong with the ear, they just hand over cleaning solution and ointment. Here you go. Wrong. No medication should be given to ear infection cases unless a culture and sensitivity test is done. Yes, and you must explain to the pet owner why. And that's very important. Put your foot down. Number 5, tick diseases. They are bad, and you have to emphasize it. You should emphasize that not only is Lyme disease transmitted from ticks to humans, there are many other diseases. And if you have one, which you must, you should give the pet owner a list of tick-borne diseases transmissible to human being. And that's the reason their pet must be tested for tick-borne diseases also. Show them pictures and the list of diseases they can be transmitted from pets and ticks to humans. Well, now you have these 5 vital tests. Let me reiterate. Zoonosis, you don't say fecal test. Senior citizen blood profile, because senior citizen humans, pet owner, they know it. Chubby pets, ear infection, and tick-borne diseases. All right, let's do some simple math. Okay, it's very simple. Here are the tests. Fecal zoonosis, you do one per day, and your cost is $20, and you do 5 tests per week. The total is $100. I just picked these numbers and just to make a point. Number 2, thyroid for chubby pet. You also do one a day at the rate of $75 per, and 5, it's $375. Okay, for senior wellness exam, the total for the week is $475. Culture and sensitivity, it's $325 for the week. And Lyme plus tick diseases, this is very low, $55 per test, 5 tests per week, $275. So the total is, for the week, 25 tests, it's $1,550. I'm positive it's a lot more than that because I made this slide 3 years ago. So here is a simple math. $1,550 per week for 50 weeks. What will be the total? Yes, 77.5. per year. $77,500 per year. Yes, it's a simple calculation. And my friend, you can say, holy cow. Yes. And if the number goes up, it will be more than 77,500. Do the math. And here are the rules you should never forget. Rule number one, all hospitalized pets and all pets presented with medical problem must have pre-treatment, pre-hospitalization, and or pre-surgical blood test. No exceptions. Period. I know you do it all the time. This is nothing new. Really? Some of us, a few of us, they don't do that one. Well, consider this as a reminder. Rule number two, and this is very vital. Do the following. I'm going to explain to you in the next slide. And main thing is explain to the pet owner in person, face to face. That is the key point. Face to face. What are you going to explain? What the test will tell you and the pet owner. As a veterinarian, why you're doing the test and what the interpretation and what kind of information you are going to get to help the pet and also explain the pet owner why her pet needs this test. What will happen if the test is not done? Are there any alternative tests? Yes, you will have to explain to them. How reliable is the test? Yes, you tell them that you send it to bona fide laboratory and they are quality control, or you do in the house, it's quality control done by a qualified technician. That's why they are reliable. You will have to convince the pet owner. Does the pet need any before and after care? When will you get the result? That's a key point. Always tell them that you can get the result overnight or as soon as possible, because human patient, they don't get the call for a week or 10 days and things they go wrong, results they fall through the cracks, and human patients, they are aware of that. So you will have to make sure to convince them that you will get the test result next day or in a day or two. What can go wrong? Your pet owner might ask that one, and you should be prepared to answer that one. Where will the test be done? That's the critical point. Whether you are sending it to outside laboratory or you're going to do in the hospital, you will have to explain to them, and that will raise their confidence in you. And again, the result of the test. Will you discuss the test face to face? Of course, yes. Rule of thumb, vital rule, never discuss the result of your blood test over the phone. Okay? All right, let's move along. Here is the rule number 3, and that's a vital. Document in the pet's medical record that you discuss all of the above with the pet owner. What are the all of the above? The 10 points I explained to you in the previous slide. Those are very, very vital. Well, let me repeat it. Let me reiterate. Good medicine makes good money. So what are you going to do? Each day, perform at least one of each 5 tests. The key is what you say and follow the rules to the T. And go over this simple mathematics. It's a very simple calculation. You can again say, holy cow. And guess what? You will have, if you follow my suggestion, you will have a profitable and successful veterinary practice. You're not going to get rich overnight, but it will add up. Well, my friends, this is Dr. Correa from vetmednetwork.com, and I hope you are going to implement these suggestions.